Hi, my name is Aoife McDermott and I'm a nurse here at the Heartbeat Trust, and today I'm going to talk to you about high blood pressure. Blood pressure is a measure of force that your heart uses to pump blood around your body. Blood pressure is measured in two parts, the systolic and the diastolic pressure. Systolic pressure is when your heart pushes blood into other parts of your body. Diastolic pressure occurs when your heart rests between beats. High blood pressure is when the systolic pressure is higher than 140 or the diastolic blood pressure is higher than 90 after several readings. If you have diabetes, blood pressure over 130/80 is considered high. High blood pressure or hypertension means that your heart has to work harder to pump blood around the body. The blood vessels that transport blood around the body are usually stretchy. However, if you have high blood pressure, the vessels lose their elasticity and become stiff or narrow. Fatty materials can easily accumulate in these narrow vessels and block them. Some people who have high blood pressure will experience symptoms such as blurred vision, headache, or shortness of breath. However, a lot of people who have high blood pressure won't have any symptoms, so it's a good idea to get your blood pressure checked regularly with your GP or pharmacy. There are many factors which raise your risk of having high blood pressure. Some of these we can change and some we can't. One factor which can't be changed is age. Older age is the #1 factor that contributes to a person developing high blood pressure. Blood pressure increases with age as our vessels become stiffer. Genetics also plays a role, and if you have a family history of high blood pressure, or if you are African or Caribbean origin, you are at greater risk. Even in these cases, you can improve your blood pressure by changing your diet or being active. Stress is also a big contributor to high blood pressure. Lifestyle factors play a big role. Unhealthy habits such as diet, smoking, drinking too much alcohol or caffeine, being overweight, and a lack of exercise can all lead to high blood pressure. High blood pressure is a serious condition, and if not detected or left untreated, you are at high risk of developing heart disease, heart attack, stroke, heart failure, and kidney problems. There are two approaches to managing high blood pressure, both of which are equally important. The first, lifestyle issues. These are really important. They include regular exercise, weight reduction if relevant, moderating your alcohol intake, and avoiding taking too much salt. If you feel stress may be causing your blood pressure to increase, then relaxation strategies such as mindfulness and meditation may be of value to you. The second is medication. Despite the effectiveness of a healthy lifestyle, a lot of people with high blood pressure will require medication. Indeed, the majority of people will require at least 2 medications to control their blood pressure. To check the medication is working, we may ask you to wear a 24-hour blood pressure monitor to see what your blood pressure is like throughout the day while doing your usual day-to-day activities. Most people taking blood pressure medication will not experience any side effects. However, if you notice anything unusual after starting your blood pressure lowering medication, let your nurse or doctor know, as changing to a different medication may address the issue. Remember, even when your blood pressure is controlled properly, you must continue to take your medication.